So you are interested in hearing about tattoo removal, is that correct?
Correct.
All right, so give me a little bit of background about your tattoo, how long you've had it, color, all that good stuff.
So I'm 33. I got it at 21.
Okay.
I wanted the cool fad rib tattoo and a quote in a different language, and sometimes I don't even know what it says. And at this point, at the location between weight gain, weight loss, and back and forth, it's now looks like one black blob because how it was done, it was shaded over like a bunch of times. It just wasn't done well to begin with.
Okay.
And then with the expansion of my skin and everything, body, whatever you want to say, it's now one big blob.
All right, perfect.
And not good looking.
Sure. And was it done by a professional here in the U.S.?
Correct, yes.
Okay, all right. So it's about 12 years old? Okay,
correct.
Perfect. And are you familiar at all with tattoo removal?
I know a bit about it. I've seen videos on TikTok.
All right, okay. So actually how tattoo removal itself works, the laser is not removing the tattoo. All the laser is responsible for is breaking up that pigmentation to smaller and smaller particles, so it's easier on your body to actually flush out that ink. So it's not something that you have treated once and then it just all of a sudden your tattoo's gone. It can take a while because there's so many variables at play. The type of ink that was used, the depth that the ink was placed, the age of it, and also even the location on your body. So it isn't something that I can say exactly how many treatments it's going to take. I can just always assure you that I'm going to treat you safely and effectively with the best known lasers in the market for it. We do utilize the picosecond laser here, which is definitely the gold standard for tattoo removal. It is not the most comfortable of procedures. It is a little spicy, but that's easily mitigated with just literally cooling the skin. So applying ice packs to help numb it, and we use what's called a Zimmer cooler to blow really, really cold air on that area, and we get you through perfectly through the treatment. Its saving grace is it's extremely fast, so I can take whatever breaks you need, but we'll definitely get through it.
Okay. Sounds good. I'm excited.
Perfect.
I can handle it.
We do like to space the treatments out about 10 weeks in between. Treating sooner does not make that tattoo go away faster. It would just be more money out of your pocket, more discomfort, and possibly even can cause scarring and unwanted side effects. So I like to wait a minimum of 10 weeks in between the treatment, and then you will just slowly start to notice over the passing weeks and months that less and less of that tattoo is, that ink isn't as prominent as when we started. And it doesn't necessarily go away perfectly even. It breaks up so that you have some areas that, go away very, very nicely and quickly. Others can be a little bit more stubborn, but eventually we'll be able to get all that out.
Okay, great. I'm excited
Perfect.
to see it.
All right. Do you have any questions?
Is there any maintenance afterwards that I need to do or, stay out of the sun? I've seen stuff about that.
Yep. Okay, perfect. Yes, so you are going to want to keep the tattoo covered with just a thin layer of Aquaphor, just like a Vaseline, and a non-adhesive bandage as that skin itself is healing, because it can cause blisters and even some scabbing. So we want to make certain that we're diligently taking care of it. You'll want to avoid sun exposure for 4 weeks before treatment and for 4 weeks after. But once that skin heals, which can be anywhere from just 1 to 4 days, then you can go back to your normal activities and you'll be completely fine.
Okay, great.
All right.
Awesome. Thank you so much.
All right, let's do it.
All right.